Jefferson Close-Up, and I'm Carol Celine. My guest today is Dr. William Young. You had a rather unusual upbringing. Your father was an American diplomat, so you lived in lots of different places. And I can imagine for a child growing up that was both exciting and difficult. So when you came back to the States, what was it like for you?
That was actually our hardest move. When you're the kid of an American diplomat, they kind of take good care of you. Then when we came back, I was a teenager, so I was probably, due for a little bit of teenage angst, but I came into a bit of culture shock. It was very alien. I built up this idea of what it was like to live in America. I hadn't lived there for 4 or 5 years, and I didn't remember it very well. So it was a very strange experience.
Oh. You became a neurologist because you discovered in medical school that you had a special kind of a knack for problem solving. But why did you specialize in headaches?
That was just blind luck. I was looking for a job in Philadelphia. We'd been here for a year, and I was changing jobs from one practice, and I interviewed at 3 practices, and my favorite one was with this guy called Steven Silberstein, who was just about to become probably the most famous headache doctor in America, and I was thrilled to be involved in that, and it's been nothing but great since.
How have new kinds of brain imaging changed the way you understand headaches?
Well, when you talk to a patient who has headache and they describe their symptoms, you can kind of see the parts of the brain that are involved. So as my patients are telling me it hurts here or they get nauseated, in my mind I feel like I'm peering into their brain and I'm seeing different things light up in different sequences. And with the new imaging, we're starting to see this kind of brain activity that correlates nicely with the symptoms that our patients have been describing.
What would you like people who are watching this to know about you and the Jefferson Headache Center?
Patients who have chronic migraine feel more stigmatized by society, by the medical system, than people who have strokes or epilepsy or multiple sclerosis, even Alzheimer's and Parkinson's disease. And the field needs advocates, and I'm trying to do some of that.
And can you give them hope?
Absolutely. I have nothing but hope, even for the most refractory disabled patient.
Wow, that's good news for someone listening, I'm sure. Thanks for joining us.
Thank you.